Hello everyone. Welcome to Well Within Reach. And today we have with us Nurse Colleen Hee, and she is a patient navigator in the stroke program at Thomas Jefferson University Hospital. We're so glad to have her with us today. And this May being Stroke Awareness Month, we're especially happy to be here today. So today we're going to talk about when a person has a stroke and they're ready to go home. So one of the first questions that I want to ask is that a person who's had a stroke, how likely are they to have a second stroke?
Yeah, so 1 in 4 patients are likely to actually have a second stroke after their first. And the time frame after you have a stroke, within the first 3 months, you're actually more likely to take that second stroke. So it's really important having a stroke and going through that whole recovery process after the fact to try to prevent a second one from occurring.
Oh, wow, that's a pretty high number.
Yeah.
So what can an individual do to prevent having that second stroke?
So the first thing, actually, patients and their families and their support systems should be aware of what the signs and symptoms of a stroke are to be able to identify it quick and act in a timely manner to get to the hospital immediately. So we try to teach our patients an acronym. It's B fast to help quickly identify any signs and symptoms. So B stands for balance. So if a patient or a family member or anyone in the community is experiencing a sudden loss of balance, coordination, kind of like they feel very dizzy. They could be almost like you feel like you're on a boat, you're kind of rocking back and forth and can't get your bearings. That can alone be a symptom of a stroke. So you want to act quickly, call 911, get to the hospital. The next letter in BFAST is E for eyes. When you have a sudden change in vision, it can be blurry vision, double vision, loss of vision, any sudden change from your baseline. Again, you or anyone you're with, to quickly identify that change. Again, call 911, get to the hospital as quick as possible. The next letter is F for face. You identify on someone else that their face is drooping. It's typically one side of the face. You could also have some drooling coming from your mouth. So again, quickly want to call 911, get to the hospital as quick as possible. A is the next letter in that acronym, which stands for arm. Could also include leg, though. So sudden onset of weakness or numbness, tingling to one side, typically of the body, arm or leg. It can be so severe that you can't move your arm, can't move your leg. Could also be very mild. So if you're noticing as you're eating or drinking, you go to use a utensil or try to pick up a cup and all of a sudden you can't grasp it. You've kind of lost your ability to use your skills to pick up that fork, and now you're using your non-dominant hand. That alone could be a symptom of a stroke. So again, you want to call 911, get to the hospital as quick as possible. And then S is the next letter in that acronym, which stands for speech. Again, you want to identify in yourself or someone else if they have sudden changes in their speech, such as slurring, slowed speech, trouble getting their words out or finding words, kind of like a word salad, we call it. So if I'm having a conversation with somebody and their responses are not making sense, their sentences are not fluent, they're identifying objects or saying odd things to me, and that's not their baseline. Again, that could be a symptom of a stroke. So call 911, get to the hospital as quick as possible. And that last letter in that acronym is T. T, you're going to see sometimes is used for time, but I also like to use it for terrible headache. So if all of a sudden you have a terrible headache that comes on suddenly, almost like you've been hit over the head with something, that alone could be a indication that you're taking a stroke. That's what we call a bleeding stroke or a hemorrhagic stroke. So if you just have this sudden, sharp, terrible headache, you again call 911, get to the hospital as quick as possible. So yeah, time is really important for any signs and symptoms of a stroke. Get to the hospital, get the treatment you need. It's better to be safe than sorry. And then after, a patient has had a stroke, ways to then, once you transition to home or, if you need rehabilitation and you need to go to a facility for a short amount of time and then transition home, it's really important then to be able to know, the cause of your stroke. and to reduce your risk factors to try to prevent a stroke from happening a second time. Because, like I said, unfortunately, 1 in 4 patients who have had a stroke uh, are likely to take a second one. So when we talk about risk factors, we're talking about things like blood pressure. So, even if you don't have high blood pressure, we still encourage patients to get a blood pressure cuff, check your blood pressure at home, making sure that when you're at home, it's staying within goals. So we like that top number to be below 130, that bottom number to be below 80. Sometimes patients have personal goals that could be a little different, but that's the ideal goal. Checking that blood pressure and then keeping a log of it at home, writing down those numbers, and then making sure that you bring those numbers with you to your doctor's appointments to make sure that you are meeting the goals and that your blood pressure is not too high. Too high of a blood pressure can increase your risk of having a stroke. And
Mm.
if you have high blood pressure, it's really important to, again, check that blood pressure, but then take the medications that are prescribed. And then you can also alter your diet. So it's really important to try to limit your salt intake. The more salt you eat or cook with or add to your foods, it can increase your blood pressure. So again, just altering kind of some ways in your diet to help lower that blood pressure and keep it well controlled. That alone, managing that risk factor, can help lower your risk of taking a stroke or having a second stroke.
Mm.
The other thing, too, would be if you have diabetes. Diabetes alone, if it's uncontrolled, can increase your risk of having a stroke. So if you don't own a glucometer, which for people that don't know what that is, it's a machine that can help monitor your blood sugar at home. So you want to make sure, again, it's kind of like blood pressure. You want to monitor it, keep a log of it, because uncontrolled high blood sugars over a long period of time increase your risk, not just of a stroke, but also heart attack. It can do a number to other, things in the body, your eyes, your kidneys. So it's really, really important to make sure that you're monitoring your blood sugar and keeping it well controlled with your medications and again through your diet. So, monitoring how much carbs you're taking in, how much sugar you're eating and drinking. A lot of drinks such as, sodas, fruit juices, they're really high in sugar. And then your foods such as, your breads, your pastas, your cookies, your chips, your pretzels, kind of all those snack foods that are high in carbs, you'd want to limit as well. And then overall, we always encourage cholesterol. Uh,
Mm.
Yeah, is a big risk factor. So we encourage maintaining a healthy diet and exercise for that as well. So ideally, in our practice for stroke risk reduction, we like to see what's called an LDL, which is a bad cholesterol, as we call it, because it's really sticky and likes to stick to itself and stick to the blood vessels in our body. And over time, that can clog up those blood vessels and prevent proper blood flow and oxygen. So we really encourage a healthy diet and exercise to help maintain that cholesterol, keeping our goal less than 70 for an LDL. And the diet with that, we strongly encourage is like a Mediterranean diet. So
Mm.
trying to eat leaner meats, incorporate more fruits, more vegetables. When I say leaner meats, more so like your chickens, your seafood. So like fish is really healthy for you, has good nutrients and protein in it, whereas your red meats or your fried foods, those tend to have a lot more cholesterol and fats to them. So we always encourage to, if you're going to cook, your meats, try not to fry them, grill or bake. Try not to use butter. Butter is high in cholesterol as well. So we encourage the use of like an olive oil or avocado oil. Those are a little bit healthier to cook in than opposed to butter. And then when it comes to your dairy products, which can also be high in cholesterol, so someone drinks or eats or uses like a whole milk or 2% milk, we always encourage trying to drop that down a little bit, maybe use like a 1% or skim, or even
Mm.
switch to almond milk or something in place. And just those little changes in your diet can go a long way to help control blood pressure, diabetes, and or cholesterol. And then exercise. It can be really difficult too after you've taken a stroke
Mhm.
because you may have, a disabling, arm or leg weakness. All we try to encourage is just to get moving. So even if you try as much as possible just to even go for a walk, go outside, have maybe a friend or a family member go with you just to help support you if there's any, you need to use a cane or a walker, but just to get moving as much as you can. Because again, exercise, even just daily exercise for a good 20, 30 minutes can help reduce, again, that cholesterol, help maintain a healthy blood pressure, and help control your diabetes better. So helping to kind of monitor and lead a healthier lifestyle reduces your risk of taking not only a stroke, but also reduces your risk now of having a second stroke.
Wow, you gave us a lot of good information. So, after a person has had a stroke,
Mhm.
when you think about next steps, what are some of your recommendations for their follow-up? What healthcare providers should they be reaching out to? What kind of therapy should they be seeking? And also, are there any resources for maybe family and caregivers?
Yeah. So we always encourage, if you don't have a primary care provider, it's really important to establish one and always follow up with them as recommended, just to help, maintain, medications and health conditions and monitor any lab work or anything, refill on medications, like I said, is really important. You don't ever want to miss or skip a dose. So you want to make sure you're establishing care and following up with your primary care provider. And then it's really important to follow up with a stroke neurology clinic, just to again make sure that your risk factors are being well managed and monitored. And if you need any repeat, labs or repeat tests, that clinic is helping with that. And then we really typically encourage patients who have either blood pressure issues, cholesterol issues. Sometimes we'll get them in with a cardiologist just to make sure, again, that you're reducing your risk for, cardiovascular or heart disease, also making sure that your blood pressure, again, stays well maintained to help reduce the risk of stroke and heart attack. And then sometimes with our patients too, we'll encourage them to seek a endocrinologist, which is a provider who specializes in the management of diabetes.
Mhm.
So, our primary care providers sometimes are really overwhelmed trying to manage everything. So sometimes we will, recommend to the patients to see a specialist so that way they're getting that specialized care. And
Mm.
endocrinology has a lot of resources too. Typically they have nutritionists on board, that can provide resources. Sometimes they offer classes on nutrition and grocery shopping and all of those things that have to deal with, maintaining a healthy diet when it comes to diabetes. So, a lot of times for our patients, we do recommend and we help schedule them into these clinics and appointments. But it's just really important to, maintain that consistent follow through in the long run, because we want to help reduce your risk of taking that second stroke or reduce your risk of having a stroke in general, period. Um, and then with therapy, you know, it's patient by patient, but typically patients will receive therapy when they're in the hospital setting. And then if they're recommended when they go home, or they need to go to a rehab facility briefly and then go home, they can get either physical therapy, occupational therapy, and or speech therapy. So typically physical therapy helps with kind of the movement and the strength in your arms and your legs and your body. Occupational therapy a lot of times will help to strengthen, your day-to-day living, kind of, if you're struggling and you have some weakness in an arm, they will help you, with brushing teeth or cooking. Some of those, even buttoning or zipping a shirt, that could be something that you struggle with. So occupational therapy helps to work on those day-to-day living. And then speech therapy works on speech, but also swallowing.
Mhm.
Because after a stroke, sometimes patients have difficulty eating, regular food, or they have difficulty with their swallowing. So it's really important that if a patient's recommended to continue with therapy, they go. Sometimes patients are like, I feel fine, I seem fine. But then when they get home and they're in their own environment, sometimes it can be a little bit difficult, like I said, with cooking. So it's really important in your stroke recovery to seek out that therapy, get it scheduled, and follow through with it for however long it is recommended for you to do so.
Well, Colleen, I just want to thank you for all of that information that you gave us today. And we're going to definitely do this again. I want to bring you back and talk more about your work as a patient navigator. But for today, I want to get one final word from you that you could share.
Sure. So to me, most importantly, is if you see something and it doesn't seem right, the patient's not acting right, or if you're in the community and you're in the grocery store and you pass by somebody and they're not acting right, and you remember that acronym Be Fast, you're at church and you're sitting next to somebody and they're not acting right, that you think, could they be having a stroke? It's always to be safe than sorry. So I always encourage everybody, if you see something, someone's not acting the way that they should be, call 911, get them to the hospital, because if they are experiencing a stroke, time is really, really important. You never want to delay. I always tell people, we push, if you have chest pain, the first thing you want to do is, oh my God, I have to go to the hospital because I'm having a heart attack. Stroke is just as important. So if you see somebody, or you yourself, God forbid, is experiencing those symptoms of Be Fast, call 911, get to the hospital.
Thank you so very much.
All right. Thank you.